Osteoarthritis is basically a degeneration of the body which affect almost all the joints of the body, but commonly it's seen in the major weight-bearing joints like hip and the knee, and it's also called as an age-related process. You cannot stop it, but there are certain things which can reduce the speed of this degeneration and can improve your quality of the life. Osteoarthritis is the most prevalent form of arthritis across the globe and is the main reason for pain and disability, particularly involving the population above the age of 50 years. And as in particularly in Asian countries the population is increasing, so more and more elderly people, because of increased life expectancy, are likely to have osteoarthritis of the knee and the hip joint. And it is estimated that by 2020 around 177 millions of the people, particularly in India, will be having osteoarthritis of the major joints like knee and the hip. Usually the patient, they present with the pain of the knee or the hip joint. The pain is more when they start walking or when they are doing weight bearing. Sometimes they also have swelling of the knee or around the hip joint. Then mostly we will see the swelling in the knee joint. They also have tenderness, stiffness of the joint, and as the arthritis further progresses, the joint tend to become unstable because of the loosening of the side ligaments. Osteoarthritis is more common in women and particularly in Asian populations because of the religious activity, and they tend to sit cross-legged on the ground for cleaning and for cooking and other purposes. Usually we see osteoarthritis after the age of 50, but there are certain reasons, like if you have a fracture, old injury around the knee joint, around the hip joint. If there is a ligament injury around the knee joint, then you are more likely to have osteoarthritis even before the age of 40. There are certain factors because of changes in lifestyle. If you are obese, if you are more in junk food, you don't do any exercise, if you have poor dietary habits, and if you have underlying medical disease, then these are the risk factors for early osteoarthritis. In osteoarthritis, the symptom is a critical feature. We have pain, swelling, and if you examine the joint, you will have tenderness, you may have a stiffness, you may have deformity. After that, we do the X-ray. We tend to do X-ray both knee joint in standing position or in skyline position. For the hip joint, we do AP and lateral view. Usually in arthritis, X-ray shows slight reduction in the joint space in early stage with some extra bone formation around the margin of the bone, which are called osteophyte. And as the arthritis progresses, this space progressively becomes less and less until you reach a stage when you have both end-to-end stage. There is no cartilage. As you can see in this knee model, this is a normal knee, this is the thigh bone, this is the leg bone covered with a cartilage. In the early stage, you have slight changes in the cartilage. The thickness of the cartilage becomes less, and there is a patchy loss. In the severe stage, the cartilage is either totally gone or it's badly damaged. Besides X-ray, we also see what is the status of the muscle, because when the joints are painful, you don't use the muscles, so muscles, they become weak. Majority of the people in early osteoarthritis, they do well if they try to modify their lifestyle. You need to do regular exercise, at least half an hour walking 3 times a week, good stretching, some strengthening exercises which are taught by the physiotherapist. You need to change your dietary habit, no or minimal junk food, and if you have any underlying risk factor like thyroid issue, diabetes, then you need to control those risk factors, treat them. If the pain is more, then we try to start with a simple painkiller like paracetamol, which is given one morning, one evening. We try to avoid the dose not more than 2 grams per day. If paracetamol is not working, then we go for second line of painkiller, which are called non-steroidal anti-inflammatory agent. We try to start with the brufen or the diclofenac. These NSAID, they cause problem in the stomach and in the kidney. So if somebody is having already these issues, or if the patient is elderly, like more than 75, then you have to be careful for these 2 problems. If the painkiller, diet modification and physiotherapy doesn't work, then come the option of the injections. In the market now, there are 2 options are there, the corticosteroid or the hyaluronic acid. Corticosteroid should be given if the knee is very painful, because the effect of corticosteroid is to reduce the inflammation. It doesn't help in repair of the cartilage or healing of the cartilage. The other option is hyaluronic acid injection. These are basically oils, and they have hyaluronic acid, which is a normal constituent of our fluid inside the knee, which is called synovial fluid. There are 2 options, either we give them single shot or we give 3 to 5 injections every week. Usually these injections are painless and they don't have any side effect, unless if you have allergy to some chicken, because the source of these injection is either the bacteria or the chicken. Sometimes it may lead to slight swelling of the knee joint. How we give the injection? Like this is the knee joint. You have a kneecap also. We can go from the outer side just below the kneecap, or you can also go from the front. It takes around 5 minutes for the total procedure. People even come for this injection from the office, and after the injection they walk and go home or to their office. We advise them that for first 2 hours they should avoid prolonged standing, but after 3 to 4 hours the normal activity. If the pain is more, you might take simple painkiller like paracetamol for 1 or 2 days. Normally the effect of these injections lasts for 6 to 12 months. There are various theories how they work, and one explanation is they act as a lubricating agent. They change the internal environment of the joint. They remove the inflammatory substance which cause inflammations, and they also help in improving the quality of the synovial fluid, which is lubricating fluid inside the joint. After 6 to 12 months, you might need them again. If the arthritis is more like moderate stage, if it is affecting one joint only, then we try to reduce the load on that joint by giving brace or by doing surgery, which is a osteotomy. We try to offload that compartment. If it is more bad and involving all the 3 joints, and the patient is having rest pain, night pain, or pain is so severe that he is not able to enjoy the quality of the life, if the walking distance is progressively decreasing, if you have stiffening, if there is instability, those are the indications for total knee replacement. In total knee replacement, what we do, like this is a model of a total knee replacement. There are different kind of implant are there in the market. Some say it's good for the female, or some are giving higher range of motion, but usually the standard implant more or less they are same and they give more or less equal result, because the result of knee replacement doesn't depend upon the implant. It depends upon the experience of the surgeon and the surgical technique. If both these factors are there, the outcome of the total knee replacement will be very good. You will be able to live almost normal life. Of course, there are some precautions are there. What we do in total knee replacement with the instrument, we try to cut the surface of, this is the lower end of the thigh bone. We try to cut in the shape of the implant. Same way the upper surface of the leg bone is cut, and with the help of bone cement we fix these metallic part to the bone, and between these two we have a plastic material which allows the movement between the two metallic surface. Now usually the surgery lasts around 1 to 2 hours for one knee. Before surgery and after the surgery, there are certain things which you should know. If you are having a diabetes, there is a slight risk of infections, so the blood sugar level should be well controlled, and to prevent infection we give pre-operative 1 dose of antibiotic. If the risk is high, we continue it 3 more days. If you are on anticoagulant oral, then they need to be stopped few days before the surgery as guided by the anesthetist. During the surgery, the procedure, if the surgeon is experienced, is straightforward and there are no complications, but sometime during the surgery also there may be a risk of damaging the condyle of the lower end of the thigh or the leg bone. After the surgery, you are shifted to the recovery and you are given a good amount of pain management with the help of oral as well as epidural anesthesia, because this surgery is done under either they put injection in your back, or if you want general anesthesia, can also be done under general anesthesia. For first 3 to 5 days the pain is little more, and from the second day we encourage the patient to start walking with the help of the walker, and after 5 days we encourage the patient to walk more, and our goal should be that before the patient is discharged, he or she should have at least 90 degree of knee flexions. They should start doing static quadriceps exercise and the strengthening exercises. Usually the patient walk with the walker up to 2 to 3 weeks. After that they go with the crutches, and even in by 6 to 8 weeks even they can start climbing up and down stairs. In the post-op, we advise the patient not to sit cross-legged. They should not do any sports activity. Although some patients they do the religious activity, but it's not a normal joint, it's not a God gifted joint, it's an artificial joint. It has a life, and the life depends upon how you use it. If you don't use it properly, the life of implant is around 15 to 20 years. The implant will become loose and you will need more and more revisions. Each surgery has its own set of complications, but if you are in the hand of an experienced surgeon, the risk is very low. After the surgery, for first 1 month you will have very little pain. There is a risk of infection, but for that strict control of the surgical environment, pre and post-op antibiotic, control of any risk factor like diabetes reduces the risk of infection. Sometimes the implant become loose, but that takes long time, which is called aseptic loosening, because the cement which is fixing the component with the bone become loose. Sometimes they become unstable. So these are the usual complications.